How would you like to spend your summer? Exploring new challenges? Meeting new people? Opening new doors for a rewarding career? Think REPS. It stands for Rural Experiences for Health Professions Students. But as you're about to see, it really stands for so much more.
As a med student, after your first year, you really haven't had any clinical experience, so I was pretty excited at that opportunity to kind of put some of that book work to use.
It was awesome. I'm so used to sitting in the pharmacy room, and I see the pharmacy side every day at school and at work, and being able to see the surgeon side of it. There's not much that can actually add up to what I did at REPS.
It's really important to get medical education, but also to learn about other interdisciplinary components of the healthcare system.
There's really no monotony. The same patient I see in the clinic may also be the same patient I see in the emergency room at 3 in the morning. They don't have to be trained in medicine. This is the part of where they're getting their training. They get to see the full gamut.
The student selection process is competitive, and for a good reason. It's an exciting and valuable program. You'll spend 4 weeks living and working in small town South Dakota with another student from a different discipline. Together, you'll experience all aspects of a rural health system and learn what it takes to be part of a team that cares for an entire community.
One of the really valuable things about the way REPS is rolled out, where the students get exposure to all areas of a healthcare facility.
Just knowing how the healthcare facility works is very beneficial to me. It allows me to be able to talk to the doctors, knowing their process more.
We got to spend time with pharmacy and spend time with physical therapy, occupational therapy, because those are all going to be different entities that I lean on as I get into my career.
I think it's very enlightening for them to be able to realize that they're seeing the same things in the small rural community that they might expect to see in a big facility in a larger community.
The most surprising thing about the REPS program was just how much is available in a small town.
In the bigger cities, you have all these specialties and everything that you can, view, but not all at once. Whereas in a rural health community, it's all kind of together in the same area. And so you're able to step out and see different healthcare aspects.
REPS communities vary each year, but they all have populations under 13,000, house a critical access hospital, and are home to some of the most amazing people you'd ever want to meet.
It really gives them an opportunity to see that they can make a difference in people's lives. And people that choose healthcare careers, that's really the reason they go into healthcare is that they want to help people.
From the student standpoint, I think especially those students that are not from a small town, they realize that we are viable. And with the state of South Dakota facing very significant workforce shortages in healthcare, once that small critical access care hospital is gone, or no longer can provide those services are gone. Rural medicine is different in the fact that I'm going to see my patients at church, I'm going to see them on the main street. So when we go to take care of these folks, we think very much in the long term.
Are you ready to take the next step? Are you ready to get inspired with REPS? REPS students grow in their education and careers. REPS providers grow their teams through teaching and, potentially, future recruitment.
Providing care in a rural health setting is like none other. We know the people that we take care of. We all support each other, we all get involved. It's just a great environment, and I think it's really great for people to see that you can get involved and be active in all those outside things that enrich people's lives.
The future is bright in rural South Dakota. Come be part of it. For more information, contact the South Dakota Office of Rural Health or the Yankton Rural Area Health Education Center.